I'm Adam Salati with the eClinicalWorks podcast, and we're here in Rehoboth Beach, Delaware, speaking with Shore Community Medical about how RCM services has changed their practice. And here to give me the physician's perspective is Dr. Thomas Kelly with Shore Community Medical. Dr. Kelly, thank you so much.
Good morning. It's good to be here.
So tell us a little bit about how RCM has impacted you as the physician.
Well, to do that, I have to talk a little bit about how we started the practice. I'm a solo practitioner. I started as a solo practitioner after working for large organizations and wanted to branch out on my own. And we were able to decide on eClinicalWorks as an EMR early on. And so from the very first day of our practice, which was December 2011, eClinicalWorks has been a partner in this practice. As a matter of fact, when we opened our doors, we were still receiving our training, and our first patient walked in, and we all started to use eClinicalWorks. So it has been part of the practice since day one. We've been very comfortable with it. And so we feel, when I say we, I mean Ahmed and the rest of the staff feel as though eClinicalWorks has grown along with our practice. And specifically in terms of the RCM program, I have to talk about how it has enabled me to concentrate on the clinical side of the practice and to let me trust that the business side is being cared for well by Ahmed and also the RCM products. Specifically, I think that it has helped me to coordinate care, and it has helped me to concentrate on care in terms of several things specifically. Again, referrals. We've been able to really track our referrals. We have been able to track our preventive care. I have been able to increase the percentage of patients that are able to come in for their Medicare wellness visits, which is really important from an ACO perspective, but it's also important in terms of a patient care perspective. So it has really helped me be able to stay as the physician and not have to really split my care off into worrying about administrative requirements regarding documentation of care.
So you mentioned you're part of an ACO. That's very exciting,
Mm-hmm.
and I think you also mentioned that you're handling that coordination of care aspect, which whether you're part of an ACO or not, that's going to be receive a lot more focus under MIPS, under medical home programs that other practitioners might be participating in and be asked to perform on.
Well, we actually have the highest percentage of patients who have had their annual wellness visit in our ACO, and I think it has been the e-messenger program that has really helped us to do that. And that's really important because it's very hard to document and to try to assure that patients get their preventive care when they're coming in for acute visits, which as people know, the physicians know, that's usually why they come to see their primary care doctor. It's very hard to fit in all of the preventive care issues in those visits, and the annual wellness visit allows you to actually do that at a time when the patient is, generally feeling well. And those visits are very important in terms of meaningful use, in terms of ACO, but they're mostly important in terms of patient care. And so it's really has helped us because it sends out reminders to the patients to do these visits. The patients many times don't even know really what the visits are for. And also, most physicians realize there are more and more preventive procedures and labs that we are required to get that help us in our practice. And to be able to have an actual visit to get that accomplished is really a great tool, and not using it is really puts a practice at a disadvantage. And I will tell you too, from a revenue standpoint, it allows you to code for the annual wellness visit, and it's a good coding. It helps on the revenue side, and so I think it's really has been one of the aspects of our RCM program and our programs that we get with eClinicalWorks that's been very successful.
Right. Ahmed, in our conversation earlier, mentioned that you had put the messenger functionalities into place to do your appointment reminder calls, which made a big impact. And now you're telling us that you're using that campaign, the built-in campaigns that are ready to go to do your Medicare wellness visits. I imagine that for other practices who aren't doing that, it might be a challenge. Like you said, patients usually only come in when they have an acute problem, right? And it can be probably difficult to start that conversation about why the Medicare wellness visit is important and why they should even have one in the first place.
Yeah, it's very important. I would say that when you're a solo practitioner, you also realize that you can't really rely on a large organization to help fill in the aspects of preventive care and resource allocation and revenue generation that falls onto your shoulders. And I think that the annual wellness visit is actually one tool for the primary care physician that's really very much underutilized, but also one that there aren't that many, and sometimes there's not an incentive in other organizations for them to really try to pay attention to it. And the program at eClinicalWorks really helps us educate the patient as to what the annual wellness visit is, and many of them come in and are curious about it. And the layout in the progress note is such that it carries over from one visit to another, so that when a patient does come in for an acute visit, you really have that already documented. You just have to carry it over. It helps as a reference point. And actually, it's become a tool that I would find it very hard to practice without. And for the patients that really are resistant, I really try to sort of pester them to make sure that they eventually come in for it. I think the other thing that's really unique, I wouldn't say unique, but a aspect of the messenger system that has really helped us is we really have very few no-shows. I think our no-show occurrence is very minimal, which again is important in terms of revenue generation, resource allocation, and also just in terms of being able to be assured that that the slots that you have for the schedule for the patients are not going to be not utilized. So I think those are two aspects that are really great about it. In terms of the ACO, I know that that's something that has come in after meaningful use. I know that without eClinicalWorks, it would have been very hard for us to meet our meaningful use goals, and we were able to get through that and do that. And now it's the new world of the ACO environment, and I know that we have begun to use eClinicalWorks for the different type of requirements. Again, as the physician, I'm a little bit not as informed as a med with regards to all the specifics about that. But I'm certain that we'll also be benefiting by the types of services that are provided for that in the next few years to come. I think for Shore Community Medical, we were starting from ground zero. We were starting from a blank slate. The first patient that walked in was patient number 1. We didn't have any paper charts, and it was really sort of a unique situation where we were able to sort of grow with eClinicalWorks in our practice. And I think at each step of the way, eClinicalWorks has been there for us in terms of providing the type of services that seem to meet the need of a growing practice. Down here in Rehoboth Beach, everybody seems to be retiring down here from places, from large cities around Rehoboth Beach in New York and New Jersey and Virginia and Maryland and Washington, D.C. And so we've had our practice grow quite a bit. Ahmed, being the practice administrator, displayed a lot of talent as it related to the first year with the billing and doing all of the meaningful use as best as he could, but it was clear that we were going to need the additional resources. And when you can do each step with the same EMR, it really is seamless because one program seems to build on top of another. And so from my standpoint, it's been very key, almost like we would not be able to have grown and to been this successful practice with over 1,000 patients and still be a solo practice in this type of environment.
Well, it sounds like with those additional retirees, you have a lot more Medicare wellness visits in your future. And eClinicalWorks is proud to be a partner with you to help deliver that top quality care that it sounds like you're giving to your patients. Thank you so much, Dr. Kelly, for being here and giving us your thoughts on this subject today. We hope we can be there for you in the future to help you do even more.
Sure.
For the eClinicalWorks podcast, I'm Adam Salati. You can watch our other episodes on iTunes, YouTube, and my.eclinicalworks.com. Thanks for watching.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.